Laboratory and diagnostic examination. Urine specimen. Clean catch midstream urine specimen for routine urinalysis, culture, and sensitivity test. Best time to collect is in the morning, first voided urine. Provide sterile container. Do perineal care before collection of the urine. Discard the first flow of urine. Label the specimen properly. Send the specimen immediately to the laboratory. Document the time of specimen collection and transport to the lab. Document the appearance, odor, and usual characteristics of the specimen. 24-hour urine specimen. Discard the first voided urine. Collect all specimen thereafter until the following day. Soak the specimen in a container with ice. Add preservative as ordered according to hospital policy. Second voided urine required to assess glucose level and for the presence of albumin in the urine. Discard the first urine. Give the patient a glass of water to drink. After few minutes, ask the patient to void. Catheterized urine specimen. Clamp the catheter for 30 minutes to 1 hour to allow urine to accumulate in the bladder and adequate specimen can be collected. Clamping the drainage tube and emptying the urine into a container are contraindicated after a genitourinary surgery. Stool specimen. Fecalysis to assess gross appearance of stool and presence of ova or parasite. Secure a sterile specimen container. Ask the PT to defecate into a clean, dry bedpan or a portable commode. Instruct client not to contaminate the specimen with urine or toilet paper. Urine inhibits bacterial growth and paper towel contain bismuth which interfere with the test result. Stool culture and sensitivity test. To assess specific etiologic agent causing gastroenteritis and bacterial sensitivity to various antibiotics. Fecal occult blood test. Are valuable test for detecting occult blood, hidden, which may be present in colorectal cancer, detecting melena stool. Hematest, an orthotolidine reagent tablet. Hemocult slide, filter aper impregnated with guaiac. Both test produces blue reaction if occult blood lost exceeds 5 ml in 24 hours. Colocare a newer test, requires no smear. Instructions. Advise client to avoid ingestion of red meat for 3 days. Patient is advised on a high residue diet. Avoid dark food and bismuth compound. If client is on iron therapy, inform the MD. Make sure the stool is not contaminated with urine, soap solution, or toilet paper. Test sample from several portion of the stool. Venipuncture. Pointers. Never collect a venous sample from the arm or a leg that is already being used for IV therapy or blood administration because it may affect the result. Never collect venous sample from an infectious site because it may introduce pathogens into the vascular system. Never collect blood from an edematous area, AV shunt, site of previous hematoma, or vascular injury. Don't wipe off the povidone iodine with alcohol because alcohol cancels the effect of povidone iodine. If the patient has a clotting disorder or is receiving anticoagulant therapy, maintain pressure on the site for at least 5 minutes after withdrawing the needles. Arterial puncture for ABG test. Before arterial puncture, perform Allen's test first. If the patient is receiving oxygen, make sure that the patient's therapy has been underway for at least 15 minutes before collecting arterial sample. Be sure to indicate on the laboratory request slip the amount and type of oxygen therapy the patient is having. If the patient has just received a nebulizer treatment, wait about 20 minutes before collecting the sample. Blood specimen. No fasting for the following test: CBC, hemoglobin, HCT, clotting studies, enzyme studies, serum electrolytes, and others. Fasting is required. FBS, serum lipid, cholesterol, triglyceride. Sputum specimen. Gross appearance of the sputum. Collect early in the morning. Use sterile container. Rinse the mouth with plain water before collection of the specimen. Instruct the patient to hack up sputum. Sputum culture and sensitivity test. Use sterile container. Collect specimen before the first dose of antibiotic. Acid-fast bacilli. To assess presence of active pulmonary tuberculosis. Collect sputum in 3 consecutive morning. Cytologic sputum exam to assess for presence of abnormal or cancer cells. Diagnostic test. PPD test. Red result 48-72 hours after injection. For HIV positive clients, induration of 5 mm is considered positive. Bronchography. Secure consent. Check for allergies to seafood or iodine or anesthesia. NPO 6 to 8 hours before the test. NPO until gag reflex return to prevent aspiration. Thoracentesis, aspiration of fluid in the pleural space. Secure consent, take V/S. Position upright leaning on overbed table. Avoid cough during insertion to prevent pleural perforation. Turn to unaffected side after the procedure to prevent leakage of fluid in the thoracic cavity. Check for expectoration of blood. This indicate trauma and should be reported to MD immediately. Holter monitor. It is continuous ECG monitoring, over 24 hours period. The portable monitoring is called telemetry unit. Echocardiogram. Ultrasound to assess cardiac structure and mobility. Client should remain still, in supine position slightly turned to the left side, with hob elevated 15 to 20 degrees. Electrocardiography. If the patient's skin is oily, scaly, or diaphoretic, rub the electrode with a dry 4x4 gauze to enhance electrode contact. If the area is excessively hairy, clip it. Remove client's jewelry, coins, belt or any metal. Tell client to remain still during the procedure. Cardiac catheterization. Secure consent. Assess allergy to iodine, shellfish. V/S, wait for baseline information. Have client void before the procedure. Monitor PT, PTT, ECG prior to test. NPO for 4 to 6 hours before the test. Shave the groin or brachial area. After the procedure, bed rest to prevent bleeding on the site, do not flex extremity. Elevate the affected extremities on extended position to promote blood supply back to the heart and prevent thrombophlebitis. Monitor V/S especially peripheral pulses. Apply pressure dressing over the puncture site. Monitor extremity for color, temperature, tingling to assess for impaired circulation. MRI. Secure consent. The procedure will last 45 to 60 minutes. Assess client for claustrophobia. Remove all metal items. Client should remain still. Tell client that he will feel nothing but may hear noises. Client with pacemaker, prosthetic valves, implanted clips, wires are not eligible for MRI. Client with cardiac and respiratory complication may be excluded. Instruct client on feeling of warmth or shortness of breath if contrast medium is used during the procedure. UGIS barium swallow. Instruct client on low residue diet 1 to 3 days before the procedure. Administer laxative evening before the procedure. NPO after midnight. Instruct client to drink a cup of flavored barium. X-rays are taken every 30 minutes until barium advances through the small bowel. Film can be taken as long as 24 hours later. Force fluid after the test to prevent constipation/barium impaction. LGIS barium enema. Instruct client on low residue diet 1 to 3 days before the procedure. Administer laxative evening before the procedure. NPO after midnight. Administer suppository in AM. Enema until clear. Force fluid after the test to prevent constipation/barium impaction. Liver biopsy. Secure consent. NPO 2 to 4 hours before the test. Monitor PT, VITK, at the bedside. Place the client in supine at the right side of the bed. Instruct client to inhale and exhale deeply for several times and the exhale and hold breath while MD insert the needle. Right lateral post-procedure for 4 hours to apply pressure and prevent bleeding. Bed rest for 24 hours. Observe for S/S of peritonitis. Paracentesis. Secure consent, check V/S. Let the patient void before the procedure to prevent puncture of the bladder. Check for serum protein. Excessive loss of plasma protein may lead to hypovolemic shock. Lumbar puncture. Obtain consent. Instruct client to empty the bladder and bowel. Position the client in lateral recumbent with back at the edge of the examining table. Instruct client to remain still. Obtain specimen per MDS order.